Hello and welcome to Ask a Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania, Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's episode, we're going to cover a very kind of interesting topic, I think a kind of a misunderstood topic, and that is the problem of cholesterol and heart disease. I think we've all seen the commercials. We all could probably name all the medications that they're marketing out there. So I guess our question for you is, Dr. Goldberg, from a chiropractic standpoint, what can you tell us and help educate our viewers on this impact of cholesterol? Why is it important, and how you can treat it effectively?
See, the drug companies have determined that cholesterol is a disease. We say cholesterol is not a disease. It's an essential nutrient. Your liver makes it. See, cholesterol doesn't cause heart disease, Jerry. It's oxidized cholesterol. It's the inflammation. So more importantly than your cholesterol is get your C-reactive protein and your homocystein. That measures cholesterol. It's cholesterol that causes heart disease. There's good cholesterol. You need olive oil and coconut oil and butter. Stay away from the hydrogenated oil. That's the low density. That's the margarine. You want to stay away from that. So you need good cholesterol. 60% of your brain is cholesterol. Every cell in your body is surrounded by cholesterol. If you don't have cholesterol, Jerry, your cells are going to collapse. You're going to be dead. So they tell you if your cholesterol is 200, you need statin drugs. 200 is fine. Leave it alone, okay? If you lower your cholesterol too much, that in itself is a disease. You'll lose your coenzyme Q10. You'll lose 60% of your brain. You'll develop Alzheimer's disease, dementia, okay? So you got to watch some of this disinformation that's on the air because the drug companies have determined that cholesterol is a disease. Cholesterol is not a disease. Your body makes it. It's essential nutrient. There's protein, carbohydrate, and fat. You need all three. See, somebody called me a fathead the other day, and I said, thank you, sir. I want to have a fat head. 60% of your brain is fat. You need fat for life.
And I think one of the key things you brought up about the drug companies, and I want to bring this up because I think this is important for us to understand. One, blaming the drug companies for the problem, or I think we have to understand what a drug company is.
It's a corporation.
Right? It is a business trying to make money. Right? So their marketing and everything that they do is for them to make money for their shareholders. Okay, so that's not going to change, and we're not going to change the marketing that the drug companies put out there. Right. But what we can change, as we state all the time, is our own education, making our own decisions on these problems, looking at all of the different health professionals that can help us better understand the concept. Don't take maybe you just have one family doctor, you put all your faith in him, you go in and he just says, take this, and you say, no problem. Add it to the other 5 or 6 that I'm taking. Not truly understanding the interaction and the impact on your body. But, what we really encourage is to pick up the phone, look at chiropractic, look at the approach that you guys take.
Holistic, which is different.
Looking at nutrition, looking at and truly understanding it. Because, one of the things that I've noticed, and you can correct me if I'm wrong on this, when a doctor goes through his training, by the time he opens up his practice and gets rolling, a lot of the stuff he has learned is outdated.
Right.
Okay? And what I've seen being in healthcare for a while is that most of their education then takes place by the drug reps and the drug companies.
That's my understanding. You're 100% correct, Jerry.
Who are spending a ton of money and whining and dining all the medical professionals out there to get them to use their drug. So with chiropractic, that's not the approach that you guys take.
We give the patient what it needs.
Right.
Diet, lifestyle, nutrition, and structure. If all else fails, Jerry, we adjust the patient. Now, let me add one thing I forgot to add. Think of the cholesterol as the fireman. The fireman goes up because you have inflammation. The inflammation is the fire. So if you had a fire, you wouldn't kill the fireman, you would put out the fire. So when you take a statin drug, Lipitor, you're actually killing the fireman. You're not really healing anything because the fire is still there, the inflammation. Okay, so until you treat the inflammation, you can treat inflammation with B6, B12, folic acid, and multiple vitamin. 99 times out of 100, the medical doctor is not going to tell you this. Why? Because they don't know. The reason they don't know is because their education is censored in medical school by drug companies. So therefore, if they don't know about it, they're going to say it's voodoo, it's quackery. See, to me, quackery is a very favorite word they use because that's just competition to the drug companies. Any competition to the drug companies, they call it quackery.
Right.
So
yeah, if they're not up on it, they just want to take the easy way out and say, "Oh, I would never do that."
That's right. If they're
You
not
know,
up on it,
right.
they're down on it. So
Right,
they're
right,
down on
right,
it.
right.
Okay?
I think, as we've always said, is that, one, I think now especially is the time for us to take an active role. Do some research. I know there's a lot of great shows out there. I mean, I'm a fan of Dr. Oz. And
Yeah, he's a good
everything
guy.
that's out there. There's some good guys out there. I think now that you're even seeing there are some medical doctors out there now who are understanding that nutrition plays a major role.
I think there's a
lot of
revolution coming here.
yeah.
And I was saying, my wife was watching Good Morning America, and she said, "Come over here." Dr. Oz was on this morning. You may have seen it. He says you want to take B complex, vitamin C, and chromium. Chromium is the glucose tolerance factor. It helps your cravings for sugar. It's sugar that causes fat. Relationship between overweight people and heart disease. So, honey, you want to treat heart disease? Get off your sugar. Okay, lose weight, exercise. Okay, what a concept. Okay.
Well, and I think the problem with people in the United States today is that they're looking for that easy way out. Okay?
There is no such
right.
thing.
I mean, do you need to exercise? Yes. Do you need to eat healthy? Yes. Does it take a change in mindset? Yes. I mean, is it going to happen overnight? No. I mean, it's you've been dealing these things for so long, you can't just change it overnight. But I think one of the things that we want to stress is you can start to take those little baby steps. Just start, make a little change today. Then maybe make another one, and just kind of build on it. You don't have to kind of go from one extreme to the other because you can't sustain that.
See, my favorite word now is the word responsibility. And my definition of responsibility, Jerry, is your ability to respond. So therefore, you got to have an ability to respond. If you don't have that, then you're just passive.
Right.
You're not being proactive. See, proactive is you take control of your lifestyle, your diet, your nutrition. You be responsible for your own health. And then you don't need drugs.
Right.
You don't need statin drugs.
Right.
Okay?
Well, now is the time for, to definitely take charge of our own health and be responsible, and so we can live a long and healthy life. When you come down here to Wellness Associates, you're going to notice the overall approach that they take to healthcare. They've got some great nutritional products that you can see on our website at AskDrGoldberg.com. Be sure to check out that. The Wellness Store and our Wellness TV channel, just to kind of look at some of the other episodes that we have. Might be some problems that you can deal with, but I think today is as good a day as any to make that change. Take that first step and say, today's the day that I'm going to start, working towards a healthier lifestyle. And why not, have that first step be pick up the phone, call Dr. Goldberg, come down to Wellness Associates, get educated on this whole concept. Maybe get set up, if you don't have a specific problem right now, get set up on a maintenance program. Dr. Goldberg will explain that to you so you can understand the importance of truly taking care of the body that you have and making it a very efficient machine. So we hope you found this to be an educational and enlightening episode, dealing with this problem that's kind of misunderstood out there. And we just encourage you to take an active role, become a participant in your own health care, and just really start to live that long and healthy life. So thank you very much for watching, and be sure to check back for some other future episodes. We got some great shows coming up with some topics that I think you'll be very interested in. So have a great day, and we look forward to seeing you in our next episode.